Hello, my name is Leo Malman, and I'm a nurse practitioner student in Maryville. This is Corey, and we're going to do a head-to-toe evaluation assessment for you today. Before this evaluation, Corey's already emptied his bladder. He's already walked in. I watched his gait. It was normal. He got into some comfortable clothes. We've taken his vitals. We've tested height and weight. And we've tested orientation. We're going to go ahead and start with the head-to-toe example. We've tested his vision already with distance with Snelling chart and Romberg for closeness chart. And we're going to go ahead and start by inspecting Corey's head. And as we inspect, we notice that the hair is uniform and covers his entire skull, no alopecia. He has blonde hair. We notice that his eyes are symmetrical, his ears are symmetrical to the canthus, nose is midline, no deviation, and his smile is even. We'll go ahead and start with raising your eyebrows, closing your eyes tight. Give us a nice big smile. Grit your teeth a little. Good deal. Now poof out your cheeks. Stick out your tongue. Move it left to right. That takes care of his number 7 cranial nerve. We'll go ahead and test. Now we'll go ahead and palpate. And we're testing for any lumps, tenderness, lesions. We don't feel any tenderness there. We'll do his facial bones. Any tenderness here? No. Absolutely. We do sinuses. Nothing there. Nothing there. At this point, I'm also going to test for his lacrimal apparatus. There's no tenderness, lumps, and there's no discharge there. Open and close your mouth. His TMJ, side to side. Very good. No popping clicks or holds there. We will go ahead and look at this point at his eyes. And as we start to notice again, his eyebrows are symmetrical and even. His eyelashes are symmetrical, even, and curled upwards as they should be. He doesn't have any ptosis, and he looks, we'll do a little check here. His sclera is clear, white. His conjunctiva is pink with no matting or discharge. We'll test pupil response, direct, consensual, direct, consensual. Very good. We'll test for the red reflex. And there that is on the right eye. And there that is. Very good. We're going to check with the cover-uncover test. So I want you to look right here and cover up your right eye. Uncover. Good. Your left eye. Uncover. No strabismus noted. We'll test the fields of his focal planes and his fields of view. Watch it with your eyes. Good. And his planes are intact. That means cranial nerves 3, 4, and 6 are intact. We will now go on to ears. Because we've done the pupils, we're going to go on to ears. And we notice that his ears are symmetrical. His auricles are soft. No lumps or masses. We're going to do the whisper test. Corey, cover one of your ears. Repeat what I say. Baseball.
Baseball.
Good. Other ear. Train track.
Train track.
Very good. We'll further test his hearing with the Weber test. Do you hear it in one ear or both?
Both.
Very good. We'll test with the rind test. Tell me when that stops.
No.
Tell me when it stops.
No.
Very good. Other ear.
No. No.
Very good. It's twice as long, so air induction is twice as long as normal. We'll go ahead and check out his tympanic membrane. His canal is clear with just a little cerumen. Eardrum is pink gray with no perforations, cone of light. And this one's even cleaner with a beautiful clear eardrum. Next we will check his nasal nares. If you lift your head up, they are even, bilateral, uniform in hair, no redness, drainage. As we look up further in, we notice that the septum is straight, no perforations, and terminates are clear and open. We will check now for his oral. We start by looking at his lips to make sure they're symmetrical, pink, good in color. Smile at me. His teeth are there, his gums aren't bleeding, open wide. His buccal mucosa is pink and moist, both sides. Hard palate is good, soft palate is good. Stick out your tongue. Tongue looks good. Lift up your tongue to the top of your mouth. Laterally, no adhesions, no masses or bumps, wounds of any type. It looks clear. His frenum is attached. Go ahead and open up. Teeth look good. Gums look good. His pharynx pillars are there. Tonsils are intact. Say ah.
Ah.
Good. And gag reflex is in force. That worked well. So we know that 9 and 10 are intact. Next we'll go to the neck, and we'll start with that. Looking at it, it looks smooth, symmetrical. There's no masses, no goiters. We'll palpate those to make sure. He has no JVD, jugular vein distension. Good pulses there. Can you swallow? Swallow's good, so thyroid's up in there. Midline on the trach. Firm. We'll push it to one side and test. I feel no masses on his thyroid. We'll go ahead and test for lymph nodes. We start with preauricular, post-auricular, occipital, tonsillar, submandibular, submental, superficial cervical chain, posterior cervical chain, deep cervical. Have you tip your head this way. Subclavicular, and this way, and no nodes there. We'll go ahead and start with the arms. Let's see, go ahead and lift your shoulders. Good job. I'm going to start with the arms. We look. They are symmetrical. Muscularity is symmetrical. Skin is warm and dry. Hands are even, no missing fingers. Nails are smooth, soft. Cap refill is less than 2 seconds. We'll test for brachial pulses, radial pulses. Both are strong and even bilaterally and clear. Let's try a pulse on these. We'll do the brachial. We'll do the radial. Biceptal. There we go. Those check out. We will now go to his back. Here's some right there. Back around. We observe the back. We notice that skin is clear. We notice that symmetrical left to right. We palpate for any masses or lumps, any soreness or tenderness. Anything there?
No.
Okay. We check the CVA, take a deep breath. Thoracic expansion is normal. Palpate CPA. Any tenderness there?
No.
Good deal. We percuss. Good. That's good. Say 99.
99.
Again.
99.
99.
99.
Very good. So we're checking for tactile fremitus. We're going to go ahead and check for diaphragmatic excursion. What I need you to do is take a couple breaths and then take a deep breath and hold it. Good. We're chesting to where the diaphragm is. Right there. Okay, breathe. Take a couple regular breaths and blow it out this time. Good, and hold. And there. That works out to be about 2.5, 3 centimeters, which is normal. And we're checking the back at this point. And we look at it, it seems to be twice, maybe even more of that than the side, so laterally, which is normal. We're going to go ahead and listen for breath sounds at this point. Symmetrically, bilaterally. Deep breath. Good. Deep breath. Again. Good. 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 And one more. And lift your arm up. Deep breath. Laterally. Again. Good. Good. All lung sounds, all fields are clear. Now we go to the front. We check out the front, make sure that we're symmetrical. We also feel no lumps, slips. Breathing is normal, no rises. And we're symmetrical across. Say 99.
99. 99. 99.
Good. So tactile firmness is fine there. We're going to go ahead and percuss. Okay, that's good. We're going to go ahead and listen for breath sounds at this point. Deep breath. Deep breath. There we go. One more. Good. Okay. Very good. Lung sounds are clear in all those fields. We're going to go ahead and have you lay on your left side. We're going to feel for an apical pulse. And along the sternum on the left and right side. That we are feeling. So I'm going to have you go ahead and roll on your back. I'm going to come around on the other side of the table. We're observing his abdomen at this point. His abdomen is symmetrical. Umbilicus is midline and inverted. And he has slight striae on his lower abdomen. We're going to listen for vowel sounds in all 4 quadrants. Now we're going to listen for the artery sounds, starting with aortic. Renal, left, right, iliac, and femoral. I hear no bruits or frills there. So at this point now, we're going to percuss to listen for tympanic. It should be tympanic except for over an organ where it'll be dull, like it is right there. We'll find the border right there. We'll come down here. That puts it about 9 centimeters, which is normal, between 6 and 12. We'll check for his spleen. There's the dullness there. His spleen is right about the 10th intercostal space, but not extending any further than that, so spleen would be the right size. We're going to go ahead and lightly palpate. While we do this, we observe for any distraction or pain on the patient's face. Any problems, any pain, any softness? I feel no masses or lumps. Okay, now we're going to go a little bit deeper. Any pain with that?
No.
Okay. Checking out internal, there is no masses. No feeling of peristalsis. We're going to test for the boundary of the liver. Take a deep breath and hold it. Liver's right there. We'll test for the spleen. I can't feel that. We'll test for kidney. I don't feel the kidney there. Don't feel it there. What we're going to do at this point is I'm going to have you kind of lift up like you're doing a sit-up, but not all the way right there. We're feeling for muscles, muscle form, muscle structure, or any hernias, and it's clear. Go ahead and there. We're going to go ahead and start with legs. We want to check. They seem to be unilateral or bilateral with muscular. Hair is uniformed. Temperature is warm consistently and dry. We're going to test range for hip with the leg raise. Any pain there?
No.
Good deal. I'm going to turn it sideways. Lift it there. Any pain there?
No.
Good deal. Again with this one. Pain?
No.
Good. Turn it this way and out. Good deal. Now what I want you to do is I want you to take this heel and rub it along your right shin. Good deal. Do the other way. Very good. We're going to do a little sensation testing here. Tell me whether it's sharp or soft.
Soft. Sharp. Soft. Sharp.
Okay, 1 point or 2?
1, 2, 1, 2, 2, 2.
Good deal. All right. We're going to have you sit up at the moment. So go ahead and sit up. Now what we're going to do is we're going to test for reflexes. I'm going to start by patellar. I need a bigger hammer. We're going to start with Achilles, or go with Achilles. So we've done reflexes, we've done pulses, we've got to do pulses. So we'll do pulses here for your popliteal. We come here and do your tibial posterior tibial, and your pedis. Those are good. Again, on the right side. And Pete. Those are good strong pulses bilaterally. Next, we're going to do the muscular. So I'm going to have you stand up. Arms out to your sides. I'm going to try to pull your arms down. Don't let me. Okay. Push them up. Okay. Turn this way. Once you ski pulls, I'm going to push your arms down, out. Don't let me push them. Okay. Okay. Good. And good. We're going to do a Romberg. Feet together. Hands out like this. Eyes closed. 30 seconds. You can wobble but don't fall, but you're nice and steady. Good enough. Let's do a deep knee bend. Very good. I'm going to try one other thing. Sit down on the table. We'll do muscle strength here. I'm going to pull your leg out. Pull back. Okay. Push forward. Okay. Pull back. And push forward. It's not leaking at all. All right. Gas pedal. Pull it to your nose. Good. Towards your nose. And gas pedal. Okay. Plenty strong there. Do you have any questions, Corey?
No.
Then we conclude this test.